The minimal residual disease assessment in bone marrow is the one of the strongest prognostic tools to predict overall survival and progression-free survival in myeloma. However, the MRD assessment in the apheresis product in patients, in transplant-eligible patients, is not well known. And based on this background, we decided to conduct a study including more than 400 patients who underwent autologous stem cell transplantation in order to evaluate the baseline characteristics of the patients with MRD positive in the apheresis product and its correlation with response and survival. Clonal plasma cells in the apheresis product were detected by flow cytometry in 10% of our cohort. In our series, tumor burden, high-risk cytogenetic, or the treatment used in induction were not correlated with MRD positive in the apheresis product. However, and as expected, the response achieved before the stem cell collections was associated with MRD positive in the apheresis product, being significantly more frequent than these patients achieve partial response or worse. It's important to highlight that MRD positive patients in the apheresis product presented shorter progression-free survival as well as poorer responses throughout follow-up. Also, I like to highlight that MRD positive could be a potential predictive factor to functional high risk, because 40% of these patients relapse in the first 24 months after autologous stem transplantation, significantly more frequent than patients with MRD negative in the apheresis product.